We are back on MorningLine. Thanks for joining us on this Tuesday, talking with Dr. Tracy Jackson. She's from over at Vanderbilt. You're a pain doctor.
Yes, I'm an anesthesiologist, but I have a specialty in pain medicine.
Pain medicine, which to so many people is such an important thing. We're talking about the opioid addiction that is out there, or the treatments of pain and all of this. Now, you've given these TED Talks, okay, which have had a lot of hits on YouTube. And again, it's called?
The Hardest Pill to Swallow.
Yes, it's one of the hardest pills to swallow. And okay, so the topic of this that's gotten so much attention is what? The alternatives to maybe some of the pills that are out there?
So the real issue I've always had as a pain doctor is that we come in and we talk about all these alternatives that have been proven in our literature over and over to work better. And these are integrative options treating the body and the mind together, because with pain you cannot separate them.
Right.
Even if it's actually a broken bone that doesn't heal and goes on forever, this will affect all the aspects of pain and sleep and mood that can be more effectively treated in an integrative strategy, body and mind. And we've known this for ages, but it's not really covered by typical insurance.
That's the problem.
Yes.
That makes total sense.
Right.
Oh, but they won't. Now, why is it not covered? Is it because it's not accepted as being conventional medicine?
Well, it's not a quick fix.
Yeah, that's true.
So,
that's true.
We're looking for a quick fix for a chronic problem that doesn't exist. And the frustrating thing for providers and patients is that although we may want to prescribe those things, the rehabilitative therapies and cognitive therapies, they're not readily available in Tennessee. They're not readily approved by insurance. And it does take a long time to see changes. They'll be much more durable than a quick fix, but that's not really the way the system is set up. And that's what's really frustrating to me, that the data shows that we need a better, more durable solution that can help pain without opioids, and it doesn't exist.
But for real, all right, you gave an example. If you had, and this wouldn't really exist, I suppose, or maybe it could, a broken leg that never heals.
Yes.
All right, which means it's always going to be hurting, okay? Your leg's messed up, and it never heals, and that's the type of thing you think, I'm going to have to take a pain pill for the rest of my life. Now, if you can't heal that sucker, how do you block the pain that's coming from it with something other than a pain pill that blocks the pathway?
Exactly, and that's a good question. And what the opioid pain pills do is they increase your levels of endogenous opioids, which dull.
Okay, it just dulls it. It's still there, but it's dulling it.
Right. We're trying to really, with other non-opioid medicines, get to the root cause of the pain. If there's nerve injury, for instance, opioids are not the best medication for a nerve-type pain.
Okay.
Medicines that calm down overactive firing of nerves, like that were often developed as anti-seizure medicines, because seizures are a lot of nerves firing at the same time.
Sure.
So we use anti-nerve pain medicines. We even use medicines that were originally marketed as antidepressants because of what I mentioned earlier. Because those pathways are all the same in the brain and spinal cord, the chemicals that you use to manage depression are the same chemicals you use to manage pain. And so the big misconception is things like cognitive strategies or rehabilitative strategies.
And what is cognitive strategy? What would that be?
These are sort of coping skills, biofeedback. So basically learning to distract yourself, learning to calm down the excitability and calm down your fight or flight system, basically.
Sure.
So there are a lot of evidence-based psychological techniques that these work. And movement therapies, exercise, physical therapy, yoga, do the same thing, like help the body heal itself long term.
It's kind of the cognitive stuff. It's kind of like training your mind to not focus on that, and just take your mind off the injury. And how long does it take for that to become something that's going to work for you on a daily basis?
So I mentioned this in the TED Talk as well. Harvard neuroscientists have recently shown that in a 12-week study, you can actually change the very structure of your brain by doing nothing but changing the way that you conceptualize and approach your pain.
And it's awesome.
And it's really amazing, but that seems crazy. I mean, I'm from a small town in eastern North Carolina. I mean, that seems crazy to me that can happen. And so part of it is education, that this stuff that sounds like a lot of voodoo actually is something that really works. And in our most prestigious medical journal, the Journal of the American Medical Association, recently showed that these cognitive programs that include mindfulness and stress reduction and movement are so much more effective than our traditional care with pills and procedures, with things like opioids and steroid injections, and that the results last so much longer.
Is there any way then, that you talk about in your TED Talk, or if insurance isn't covering it, I don't know if you need to go to a therapist, you go to someone like you, are there ways people can do this at home on their own to try to just start thinking the right way?
There are. I mean, there are a ton of data online. You and I both know that some of that's really good and some bad. At Vanderbilt, we do have a Center for Integrative Medicine called the Osher Center for Integrative Medicine that does a lot of community outreach, also has a lot of information about web-based resources or even programming there about these integrative options. That's about the closest thing we have. What still is happening is that people with pain go to multiple different doctors for multiple different symptoms, and really pain is sort of an underlying, chronic pain is probably best thought of as a single underlying disease that if you get a whole team of experts under one roof that understand it, can be treated a lot more effectively without opioids.
And the time, like you said, can be up to 12 weeks. I mean, within 12 weeks, a change can come about.
Certainly. And some of the programming, integrative programming I'm talking about that's evidence-based and mentioned in my TED Talk is about 3 weeks.
Then why aren't we doing it? I mean, I'm just looking at these numbers, and maybe it's because we need more people like you speaking out about it and Vanderbilt becoming involved. But I mean, the bottom line is people are just dying.
It's absolutely true, and I think what we were discussing earlier is so frustrating is you can't just take away opioids without providing people other viable alternatives. You can't just put people in rehab for opioid addiction and not address the pain for which they took the pills in the first place. This isn't about stigmatizing patients with chronic pain. This is about finding better solutions. And right now those solutions don't exist because insurance doesn't cover them. It sort of flies in the face of our quick fix multi-doctor system, and it is not a rapid solution, and a lot of providers don't know about it. So the reason that I did this TED Talk and come on these programs is to let people know there are alternatives so we all can advocate, so that we can talk to our insurers, our doctors, our legislators, and demand that there's something proven in the scientific evidence that works that we're not doing, and why.
Can we take a call too?
Sure.
All right, he's talking in my ear, and let's take Greg. Greg, good morning. Hi, Greg, are you there? Well, we had Greg. Greg, are you there? Let's see, we'll come back to Greg. Let's try Ernest. Ernest, are you there?
Yeah, I'm here.
Hey, go ahead, Ernest.
Yeah. Several years ago, I was in a bad accident, and they sent me to a pain clinic. And, several years ago, I was in a real bad accident, and they kept sending me to a pain clinic, and kept giving me medicine after medicine after medicine till I was non-functional. And I went to a different doctor finally, and they got me off all the medicine. And I asked them why was I on it to begin with. Is a lot of this stuff not the patient but the doctor pushing medicine to get kickbacks off of it?
Ernest, thank you for calling. I can't speak to the reason why each physician does what they do, but I will say that doctors are complicit in this. I am definitely not standing up here blaming the patients. Opioids are demanded, yes, by a lot of patients, but there is very little education about chronic pain in medical schools. In fact, a recent North American study said that there's only 3 hours of fragmented, incomplete, and sparse total education about chronic pain, which is the #1 presenting complaint to U.S. doctors.
It's unbelievable.
So just like the lay public who, that's as much as you can get from reading about things online. And so I think it is incumbent upon physicians to educate ourselves about these other alternative treatments and the efficacy of those so that we can provide them to patients. The other issue to which you allude, you mentioned something about kickbacks, and I don't know that I would think most doctors have or
kickbacks from pharmaceuticals or something
anything
like
that. But I will say that a lot of the other options are more expensive than opioids for patients. They're not as well covered by insurance. So that's the other big issue.
But shouldn't, and what I think I'm hearing, if you're right about, which I'm sure you are, the amount of training they get on this kind of stuff, which isn't much. All right, a good pain doctor, I would think, would have someone come in like Ernest and say, okay, you've had this accident, and I know you're in some acute pain now, and what we're going to try to do is give you something to give you some relief right now, okay? And maybe that's going to be for a few weeks, maybe it's going to be for this month, but while we're at that, part of it now is we're going to address your issues, and you need to understand, you're not going to be on all these pills this whole time. We're going to wean you off of these 30 days, or I don't know if the right word's wean, but I'm not going to write you another prescription after that. Now, of course, he can go somewhere else if he's desperate for pills, I guess, and go to another doctor. But shouldn't a good pain doctor say, okay, we're going to start you on this, but here is our plan. Let's sketch out what ultimately we're going to do so that you're not taking these pills the rest of your life. And I don't get the sense that many doctors like Ernest's do that.
Right, and again, I can't speak for all doctors, and there are some pill mills. You know, if you're going to a pain clinic and they're asking you only to pay cash and they only write 3 medications, that's not the place you need to go.
Thank you, exactly.
It's very frustrating for patients, though, because the number of board-certified pain physicians in Tennessee is actually quite small.
Okay.
And so we want people to come to Vanderbilt and come to see us, but I also want to expand programming so that's available to more and more people. And again, rather than, I think the thing that's frustrating to all of us, rather than putting blame on doctors or blame on patients or blame on the opioids or blame on the addicts, I think we need to be very compassionate that people generally are doing the best they can. But in order to have a real solution to this problem, we have to provide better alternatives, and they exist.
No, you're right. The blame game doesn't necessarily work, but it does seem it's awful easy to get a prescription for a pain pill sometimes. And maybe those limits need to be, because you're right, if one of his doctors didn't want to write it like I suggested, he could always go to another doctor, right?
And a lot of people do. And again, like I mentioned, chronic pain is a horrible thing, and so people will tend to go see multiple doctors for second opinions, not through through just common sense. They would love to have the best treatment that they can get. And the problem with that is you end up having people getting multiple prescriptions from multiple providers. Not necessarily opioid prescriptions, but medications for anything. And then those medications become quite dangerous in combination. And
but does it also happen, though? I mean, we're talking about staying on the pills while you still have the injury, but isn't it true, though, you get on these pills to begin with maybe, and then you heal? But then you're addicted, and you're still taking the pills when you no longer have the pain, right?
Yeah, and you know, I want to tread lightly. Just because people have been on the pills for a long time doesn't mean that they necessarily meet the criteria for addiction, compulsion, and constant craving for the medications and things like that. But you do become sort of both physically tolerant on the medicine. So if you stop them, you have a withdrawal symptom, and you psychologically, when you first wake up in the morning, you want to first think, where are my pills? I want to make sure that my pills are there, and that's really no way to live a life. And there are alternatives, and there are ways to come off those medications safely without worsening pain.
Let's take Greg. I think he's back on 2. Go ahead, Greg. Go ahead, Greg. What's your comment?
Hey, Dick.
Hey.
It's kind of, you kind of know where I come from on all this stuff. Follow the money.
Follow the money. You think a lot of the pain industry is all about money, right?
Of course, if they can get people addicted to drugs, what does it do? It sells more drugs, and now they're going to come up with a new drug to get you off of what they got you addicted to.
Well, I mean, what is it? Suboxone's one of those, right? That's supposed to wean you off?
Yes, and we were talking about this, and Greg, actually, I mentioned this at the very end of my TED Talk. You're exactly right. I mean, there's a pharmaceutical lobby. There certainly is a lot of money to be made in this sort of situation. But the way to counteract that, the best tool we have is advocacy, is really getting together and speaking out, to demand other options that are shown to work. And the pathway to doing that, I mentioned in that video.
Yeah, well, I mean, you got to get the lawmakers on board, and you have to start, requiring things, getting laws passed that require these things get addressed.
Well, we have to work on ourselves and our family members first. We have to accept that even if a pill is available on every corner, that we have to stand up and look for the longer, more durable path to relief. We have to work for education, moving forward, of our providers, of the public, and then we have to advocate to insurers and lawmakers to try to get this changed.
Well, it would help if the insurance companies would cover a lot of these things you're talking about. Let's take a break. We'll be back with more of your questions and comments and our guest right after this.
This is a